Everybody's back at school this week, and I've had a lot of questions from some of my patients as to what do we do now in the afternoons with the ADHD medication. During the last 5 weeks, hopefully parents have been giving their medication every day, but have not necessarily seen the purpose of giving it in the afternoons. Because still, unfortunately, there's this perception that ADHD is a school problem and is not a home problem. For parents that see problems at home, they certainly are giving the medication. And, the medication tends to kind of wane and wear off in the afternoon. Children are getting back, they're doing activities, they're doing sport. Some children have got, obviously, homework to do, they've got activities, they've got speech therapy, occupational therapy, tutoring, extra maths, English, Afrikaans. And parents don't know what to do. They say, well, should we be giving the medicine? And how can we give it to sort of cover, medicine wears off. It works okay in class and teacher's happy. But how about the extra lessons in the afternoon? Or does my child need the medication during their sport? So these are some of the things I'd like to chat to you about and discuss. So I'm going to turn across to some of my slides and show you. So just imagine that your child is taking their medication. In this case, it's Concerta. They've taken it quite early. I always suggest giving it very early in the morning. You want the whole morning to go well, and long as you're taking it within about half an hour of eating breakfast, it shouldn't be influencing the appetite. But you can see that something like Concerta is going to start decreasing around about 5 o'clock. And after about 3 o'clock, there's not going to be too much of the medication active in the system. If we compare long-acting Ritalin and long-acting Ritalin, you can see that the Ritalin tends to work very quickly. 50% of the dose is released immediately. And you can see around about 3 o'clock, it's almost out the system. So a couple of questions I've been getting is, what happens now in the afternoon after 3 o'clock? Maybe your child has a tutor seeing your child for homework, or maybe they're doing some sporting activities. Should they be taking the medicine? Well, my advice is listen to exactly what your child thinks. Some of the sports I find that benefit from medication being taken: cricket, hockey, some of the other sports. In fact, all sports would benefit. I have made a video on the use of medication during sports activities. Children are more likely to be more energetic. They're going to focus better. They're going to engage in their sports, things like rugby. They're going to injure themselves less because they're going to be more thoughtful, more mindful of what they're doing. One of the things that can be used is a dose of short-acting medication in the afternoon. Remember, Ritalin or methylphenidate is exactly the same chemical that is in Concerta, Nucon, as well as Contramil, and they're two generics. So sometimes a top-up dose in the afternoon may be quite useful in using that medication to help in the afternoon. And you don't want to give it too late, because in some children it can influence the appetite later on, and it can also influence and impact sleeping. Interestingly enough, I've had several patients who are very wired, busy children, and they can't switch off. The only two reasons why a child generally doesn't sleep at night is that their minds are just so wired, so busy, so active, they can't switch off. And strangely enough, almost like opposite what you would think, is the medication helps switch off the mind. It helps calm the mind down. And I've had several of my patients have said by taking that extra dose of medication helps calm them down and actually helps them sleep. And then, of course, there are other children who need to be more physically active during the day to help. And then how about with exams coming up? With the added pressure of those children writing trials, there's some exams coming up, not just in matric, but in other grades. How do you manage the nighttime concentration and medication? The medication such as Concerta is a very useful medication, or Nucon, but even though it's given very early in the morning or even slightly later, it's still going to decrease and wane and terminate way before some of the children and some of the young adults and teenagers need to do some work in the evening. So short-acting Ritalin can be used in the evening ad hoc. The nice thing about that, you don't always have to give it. Also, what is quite useful at the weekends is to sometimes use different doses of medicine. You know, there might be sometimes a useful factors using 36 milligrams of either Nucon or Concerta during the week, and then perhaps maybe using a lower dose at the weekend. And Ritalin as well, you can either use 20 milligrams during the week, and then at the weekend, possibly a lower dose depending on the requirement. But it's important to keep giving the medicine, and there's no harm in giving the medication, long as there is no weight loss. So the most common side effect of stimulant medication is lack of appetite, but I like to use a reservation and say without weight loss. Then it's absolutely fine to use. So I hope that does help you understand a little bit more about how the medication can be used in the afternoon. Stimulant medication helps focus and concentration. Child feels more in control, will feel less anxious. How about children that are anxious? A couple of children in my practice have been very anxious getting back to school. Added pressure. They've often said there's so many people, there's so much noise, having to adjust. Giving medication consistently does help. So anxiety with the recent riots, if those are things that you recognize, that your child is fearful, school avoidance, doesn't want to engage in friendships, talks about worries all the time, or kind of you can see is nibbling their nails, biting their nails, often scratching their nails, pulling their hair, spending time in their room, withdrawing from the rest of the family, those are anxiety issues that we need to hear about. So if those are problems, please let me know. And those are things that can also be managed. We need to be vigilant and pick those up as soon as possible.